Well, first of all, classical Hodgkin's lymphoma is a disease of the young girls. So basically, the first peak in terms of incidence is around 25, 30 years of age. And then we have the second peak, which is in the elderly population of patients between 60 and 65. The other important thing to take into consideration is that first-line treatment strategies are curing a high proportion of patients with classical Hodgkin lymphoma, even patients that are being diagnosed with advanced stage. And this is why, taking into consideration that we know that patients with a first cancer have a higher probability to develop a second cancer, and second, patients that have been treated with chemotherapy plus minus radiotherapy also have a higher incidence to develop secondary malignancies. In these patients that constitute a young population of patients and that are highly cured with first-line treatment strategy, it's very important to implement programs to follow these patients and to be able to early detect secondary malignancies, and basically to be able to modify this higher incidence of secondary malignancies by specific programs. And I would say that probably, talking about Europe, there are countries where these long-term survivorship programs have been better developed, and I know quite a lot of them in UK. There are other countries where these long-term survivorship programs are not so well developed, but they really represent a big unmet medical need because, of course, maximizing the use of additional resources, it would be very important to identify those patients that have a higher risk for developing secondary malignancies, to be able to follow them and to try to prevent as much as possible. Taking into consideration that of course, when we look at secondary malignancies, we are always looking at patients that have been treated with treatment strategies that are not the ones that we are using right now, that have the objective, amongst others, to decrease the incidence of secondary malignancies. But secondary malignancies still represent one of the biggest or the most frequent causes for late mortality in these patients.